time it is. Marvin Devine, Huber, Axel, and you know how we do. Yeah, I got the juice. Whip game cool, make them look like cool. Always play it cool, that's the biggest rule. Fuck it, what they doing, keep on doing. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, XL and Huber, way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we when we link up. Let's go. Yeah.
Warriors around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my sweat, put on the beat, put on the map, put on my team. Take out every motherfucker in between. Know what I mean? Better myself, better my aim, better my rep, better my name. Killing rappers on my hang, I'm running chains for the fame. Never thought I would it, now I'm running. You don't wanna follow me, now I'm fucking running.
Good evening, and welcome to a special broadcast of Steve the Kidney Nurse. I am your host, Steve Belcher. Thank you. Look, tonight is going to be an awesome show. If you're not watching this show, you're missing out, especially if you're a transplant recipient or you're on the transplant list. You need to be right here, right now, watching this show. We have an awesome guest. Let me tell you, tonight we're going to be talking about digital technology and transplant. And to help me discuss this topic is renowned transplant surgeon, Dr. J.A. Graham. Man, this is going to be a great show. So again, hit that share button, smash it, share it. We need warriors here to get this information. We talk about a lot of information that's not being disseminated out there. So tonight, we're going to put that information out there about digital technology and transplant. And again, I'd like to thank our sponsor for hosting this show, CareDx, the leader in transplant care. Now look, again, share this broadcast. Now let me tell you a little bit about Dr. Graham before I bring him on. Dr. J.A. Graham is Associate Professor of Surgery in the Monty Ford Einstein Center for Transplantation at the Albert Einstein College. He specializes in liver, kidney, and pancreas transplantation. So we got all three here, okay? Got to do all three. And has a passion for improving patients' lives through treating end organ failure. currently. Dr. Graham is the surgical director for the pancreas transplantation program that has grown to service the most patients in the Northeast. He has been the lead PI for numerous center-specific trials that look to address access and disparity. He also has been a leader in the field of mHealth initiatives that assess medication adherence patterns. He is the founder of Transplant Hero, a gamified medication mobile app geared toward transplant patients. Also, he brings extensive knowledge on UI/UX design for healthcare platforms that are patient-driven and patient-centered. So without further ado, let me bring on Dr. J.A. Graham and give him a Warriors Quest welcome. Hi, Dr. Graham. How you doing this evening, sir?
Good, great. Steve, thank you so much for having me. What an intro. Can you do all of my intros for me? I'm enthusiastic. Let's get into this. This is great.
Yeah. Again, thank you for joining us this evening. Dr. Graham, can you just share, we heard your impressive career, what you've done, what you're doing. Can you just briefly share your training and how you got to this point in your life? I mean, when you grew up, did you knew you wanted to be a doctor when you were young?
Yeah, all credit to the mothers out there. My mother sort of pushed me along the way to become a doctor. But I think, no person is an island, and certainly I had mentors along the way, and I'm standing on the shoulders of giants. I chose transplant because I love transplant. Transplant is a unique field in which you recognize that people fall down, but people can get right back up. And so really the field is about giving people second chances at life. And that's what I was drawn to. I trained I went to UC Berkeley for undergraduate. I went to Georgetown for medical school and residency. I went to Mass General for research. I did research with the esteemed Paul Russell there and Jordan Madsen. I then went to Columbia University and did transplant surgical training with professors there, Dr. Jean Amond and Dr. Lloyd Ratner. And I've been here in the Bronx since 2014, and I've loved it ever since. It's been a great journey.
Wow, that's awesome. You were in my hometown. I'm from Washington, D.C., so you were right down in Georgetown.
Absolutely. What a wonderful town. Great people, great history. And I used to go to Ben's all the time on U Street.
Oh, Ben's Chili Bowl.
That's great.
Oh, man, awesome. So, Dr. Graham, let's talk about the importance of being an engaged patient. How important is that for someone with, let's just say, kidney disease, liver disease, or one that may need a pancreas transplant? How important is it for these type of patients to be engaged in their care?
I think it's supremely important. I think that patients that are engaged, they just get better care because they're able to sort of speak the language that the care providers are speaking, essentially. Mm-hmm. And when you're speaking the same language that I'm speaking, or nurse practitioner speaking, or PAs speaking, you catch someone's attention, and it really sort of helps. It really sort of means to me and other clinicians that you are engaged in your health, but you're also a partner in this journey together. And that's really what transplant is. It's a true partnership because really, I can't do it alone, and the patients can't do it alone. We need each other. And so I think sort of being engaged is supremely important. What does that look like? I think that looks like just sort of making sure on the pre-evaluation side, you really sort of listen to what the people are saying. You listen, you're going to see a lot of specialists and things like that. Bring a notebook. Jot down some questions that you may have or that you want to follow up with. I mean, there's a lot coming at you all at once. We sort of ask you to go to medical school in one day, and we know that's not realistic. So I would say just bring a notebook. Jot things down that you have questions about that you can follow up on, and certainly follow up on them. Certainly along the way, there's a lot of evaluations with other specialists. Ask them questions too. I think just asking questions, you get to know a lot about the process and really a lot about your body and your health along the way. On the post side, the post side engagement is supremely important. This is basically like a marriage when you transplant someone, and so we are basically married at the hip, and we want to know how you're feeling at all times. So we certainly don't want you to be a stranger. So you should really have your care providers almost on speed dial, so much so that you can either email them or send them a quick text. I think we're going to talk later about digital solutions that are coming down the pike that can really sort of aid with this communication process. But I think in terms of really what it means to be engaged, an engaged patient, it means just communication. We recognize that life goes on sometimes, and you get up on the wrong side of the bed sometimes. Sometimes life isn't perfect. We just want to know. We're here to help, basically. Mm-hmm. We're here to smooth out all the bumps.
Let me ask you, from your experience, have you seen patients more engaged or patients not engaged when it comes to pre and post transplant care?
Certainly, you see all gamuts of patients. The engaged patients are sort of the model patients that you really sort of hope that everyone could aspire to be like. But again, being engaged is really sort of keeping that two-way street open, on which you're sort of communicating any issues you may have with the care provider team, or maybe any insights you may have into your care as well. Certainly I've read a lot, I've done a lot of research, but I don't know everything. Perhaps the patient can bring something to the table sometimes that can really sort of maybe spur a different decision-making tree. And that does happen from time to time. And so that's oftentimes the best. I think with a partnership, there's growth, basically. The patient grows, the clinician grows, we grow together, basically.
Wow. Now, Dr. Graham, by me doing advocacy online, I had an opportunity to see patients, their personality and behavior before transplant, dealing with the anguish of dialysis and waiting, and then I seen them afterwards after they received a transplant. So with that being said, how does mental and physical demands of transplant play a part in this? How important?
Yeah, I think this is a great question. I think transplant is a little bit like a marathon. You really sort of need to go into it with the right mental mindset, and then also the right physical sort of conditioning as well. I think from the mental standpoint, I think you never want to get down. There are going to be some setbacks along the way in transplant. There are going to be some readmissions, there may be some infections. Rejection is very low, maybe 2%, but there are setbacks along the way. Never get down, and realize that your care team is doing everything possible to get the best outcome out of you. From a physical standpoint, what I would say is that you need to really sort of make sure that you don't miss any appointments that you need, especially on the cardiology side, to make sure that you're optimized for transplant. And then also, I think we underestimate the importance of exercise and a healthy diet. So I think that these things really sort of sort of portion control and things like that when eating. And really, you need to, as a pre-transplant patient, need to be really walking at least a mile a day if you can, basically. I know in the Northeast, sometimes when the snow's falling, and there's ice, probably not the best idea. But certainly if you can, and the streets are clear from ice and snow, I would say you need to be out there really sort of conditioning your body for transplant, preparing your body for transplant. And then also, like I said before, preparing your spirit and realizing that you are a resilient person as a pre-transplant patient. You've been through a lot and you've handled it well, and now you're here. And so just realizing that same resiliency you can take toward anything that sort of comes in your way during transplant.
So, excuse me. So you're saying that if a patient is on the transplant list and they've been on this, let's say 3-4 years,
yeah,
they should be pretty much preparing for that day, for when that day comes, meaning they should be doing some exercise with the permission from their physician, like you said, some walking, just getting their body prepared, regardless of when that surgery may happen. But when it does happen, that they'll be physically prepared to go under the knife.
Transplants, I'd like to think that, I'm a miracle worker and you're going to walk out of here, with doves and flutes and everything and flower petals. But transplant's hard on the body, and so I think you need to go into transplant as a patient sort of as physically fit as you can, basically. And so I agree with you. I think any exercise with the permission of your physician is definitely recommended, because it's not just the operation, but then also the medications can also sort of be a little bit of a setback for you unless you've taken these medications before. So I think just sort of preparing your mind, body, and spirit for transplant is something that patients need to do. And I think we, as clinicians, I think sometimes we sort of do a poor job of communicating that. But, when every time a patient comes to see me, I sort of talk to them about the journey toward transplant. And it doesn't begin like day or year 3 or year 4 when you're getting close. I think it really begins when we first see you and really starting to change your lifestyle and things like that. Because on the back end, a lot of the medications that we give you for to prevent rejection can worsen diabetes, can create weight gain and things like that. And so you really sort of want to go into it sort of your peak, and so that you can handle some of the medications and things like that.
Wow. Okay. Dr. Graham, what role must the patient play in their own health after transplant?
That's a great question. So I've learned a lot over the last 10 years almost of doing a transplant. And that is a lot of empathy for what patients go through. So essentially, pre-transplant, most patients are in center, about 80% in center. Another, it's a little higher than that, but about 12% are PD or at home HD or hemodialysis. But most patients are in center. And so what does that mean? That means 3 times a week you have someone taking care of you, essentially, making sure your labs are okay, making sure your blood sugars are okay, making sure your sodium's okay, making sure your volume status is okay. And then something that we underestimate is making sure that you're content, that you're happy, that your spirit is okay. It's almost like a social interaction time for a lot of patients, essentially. And so post-transplant, all of that just goes out the window. We essentially, for the first month, we see you once a week, and then it tapers off after that. And we really put the onus on the patient to really sort of take care of some of the complex things that that you need to do during transplant, such as post-transplant, such as taking your medication and such. Certainly your family is involved as well, or whoever your social support is. I think we're going to talk about it again later, but there are solutions also to layer on support that are going to be digital solutions for patients to really sort of let them know that you should never really feel alone, is basically the point I want to make for a post-transplant patient. There should be always someone you can call and you feel comfortable calling on the clinician side. Don't be a stranger. Don't go off the grid. If you feel like you're going to make a crazy decision, again, it's like a family. Like if my brother said, I'm going to go swim with some sharks, I might say, hey, maybe don't swim with some sharks, So if you feel like you're going to maybe stop or alter your medication or something, which I think about is like swimming with sharks. You don't want to do that. You really want to talk to someone about that and really sort of vet that through and make sure you're really sort of making the most informed decision you can for yourself. That goes along with the vaccine as well for coronavirus. You really sort of, if you are vaccine hesitant, you really should, instead of sort of maybe keeping this to yourself, really feel emboldened to really sort of discuss any issues you may have or any concerns you may have about the vaccine with your care provider.
That's I'm glad you mentioned that, because there's a lot of controversy despite medical evidence on this vaccine. So thank you for sharing that information. And you had spoke about medication. Speaking of that, how important is medication adherence to pre and post transplant?
Steve, this is really sort of, so I spend 3 hours doing a kidney and maybe or 3 hours doing kidney and maybe like 8 hours doing a liver transplant. And essentially my work is done as the surgeon, right? The work is far from over. The journey is just beginning. Like if you're walking to Machu Picchu, you are just at the beginning. You got to keep climbing. And so really sort of the medication adherence is really sort of the crucial piece of transplant. The CNI, the calcineurin inhibitor, the anti-metabolite, and usually most centers are using some steroid. These three medications are really sort of what are keeping your organ alive. And so, basically to really sort of drill down the point, there are numerous studies out there that demonstrate that patients that are self-reported non-compliant have much worse graft outcomes, or they have much higher graft failure than patients that are compliant. Listen, I'm under, no sort of, essentially, I understand what patients are going through. I understand that, twice a day medication, for the most part, can be difficult for patients. But again, if you want to keep your graft, this is what you have to do. And if you feel like there are maybe problems with some of the dosing of the medication or the timing of the medication, it's really best to talk to your care team. But I think what you don't want to get into is the habit, and I get it. We're all human, we all make mistakes, but you don't want to get into a situation when you're skipping medications, because essentially what you're doing is you're putting all of the hard work that the care team has done for you and really all of the hard work that you have done as a patient on the line, and really sort of missing just a few medications. It can happen very quickly, very bad rejection. And so you really sort of want to make sure that you are on top of your medications and your care team is on top of your medications too. I think what you really want to do, again, this goes back to your earlier comment, what does it mean to be engaged? You really want to learn these medications, almost like you learn, the names of the people in your family. These are as important to you as anything that you hold in high esteem. And so you really want to get to know the medications. You want to be able to say them, know the dosing of the medications, and really sort of, again, being in that engaged patient, as you talked about earlier, have that discussion with the care team. You can even ask the care team, why am I taking these medications? What do they do? And I think that can start a conversation about how important these medications are to you.
Okay. Wow. Now, as far as compliance, what impact does compliance have on long-term transplant health?
Oh, a tremendous amount. Adherence, compliance. I'm a huge passion of. That's one of the reasons why I started Transplant Hero, which we're going to talk about certainly. But compliance, again, non-compliance, I'll put it this way, non-compliance leads to much worse outcomes than compliant patients. And so you want to do everything in your power to make sure that you're compliant. Certainly there's digital solutions out there now that can really sort of aid you in this journey toward compliance. It's like anything, any behavioral change, like weight loss, smoking cessation, you really need assistance to really sort of help you along the way to sort of maintain compliance. Otherwise, you will relapse. And so what we're trying to do in the digital space is to sort of provide assistance for patients so that they don't relapse into a non-compliant state and put their organ at risk, basically.
Okay.
There's nothing worse than seeing a young man with a creatinine of 1.2 and then 3 weeks later with a creatinine of 4 because of whatever, a lot of reasons are like, family issues, sometimes financial issues, or perceived. A lot of the financial issues may be perceived. There may be some embarrassment about that. And so what I would say to any patient that feels like, this happens a lot at the 2.5-year mark, where there are some insurance issues sometimes, really sort of discuss these problems with your care team or your social worker. And what you will find is that there is a tremendous amount of resources out there to really sort of make sure that you don't fall in. I'll put it a different way. No one, no matter what, in an engaged patient is going to let them go without immunosuppressive medications. I would buy them myself probably for the patient, but I'm just saying, like, there is no way, no how at any transplant center that they're going to let a patient go without medication under any circumstances, should they feel like they're running out of medication or don't have access.
Yeah, unfortunately, in the past, I've seen situations like that.
Right.
Unfortunately, talk a little bit about navigating life pre and post transplant.
So pre-transplant is an important part. Again, you want to sort of maintain your mind, body, and spirit. But the most important part there is really sort of, you don't want to set yourself back by missing appointments. And really sort of the cardiology appointments, the mammogram, pap smear are crucially important. I would say that also you really sort of need to have a conversation with your care team to really sort of understand if you're truly active on the wait list. I've seen a number of situations in which patients thought they were active, but they were actually inactive, what we call status 7 on the wait list. And so there's a number of reasons why patients may flip from active to inactive, but you don't want to be sort of under the misinterpretation or the misimpression that you are active and you're actually inactive. You're certainly gaining time on the wait list, but an inactive person on the wait list does not qualify for organ transplant. So that is supremely important to really sort of check in with your pre-coordinator at least every 6 months, probably every 3 months, just to make sure all the T's are crossed, all the I's are dotted, and make sure you're sort of, you see the landing strip and the plane is coming in smoothly, and you just want to make sure that there's not you can handle the turbulence, essentially. As you're going into the landing, for sure.
Now,
you also, I'm sorry, you were going to say something?
No, I just wanted to say, you mentioned about active and inactive. So if a patient, say, is non-compliant with some stuff and they take the person off the list, does that mean they lose their spot from where they were at, and when they get back on the list, they got to kind of fit in where they fit in? How does that work?
This is a great question. So the rules changed a couple of years ago, actually more than a couple of years ago now. I think I'm dating myself. But essentially, the answer to your question is no. UNOS is sort of engineered in the wait list, in the total national wait list, such that you won't really sort of lose your place for the majority of patients. So really what they have sort of figured out for UNOS and put in place is that if you're on dialysis, the start date of dialysis is when your wait time begins. That doesn't mean you're active. That just means that that's when your wait time accrual occurs.
Gotcha.
And then for patients that are preempted with a GFR under 21, as soon as they come into the transplant center, that's when their time starts for dialysis. I mean, that's when their time starts for the wait list. Again, that doesn't mean that you're active on the wait list. That just means that that you have sort of benchmarked a time, you've time-stamped a time in which your time goes back to. So if I started on dialysis 2017, I was delisted or I was status 7, but I got my act together, and it's 2021, the wait time goes back to 2017.
Gotcha. All right. Thank you for clarifying that. So let's talk about, which is this show is mainly about, the importance of technology and along the transplant journey, pre and post. How important is technology now with the day-to-day health management of pre and post transplant than it was, say, 10 years ago, 15 years ago?
Oh, this is a great question too. So what I would say, how I would answer this question, I would say that the amount of smartphone utilization is going up year after year, and now 80% of adults have reported to use some form of smartphone technology, and about 60% of patients have downloaded a mobile application for health. This is in contrast to maybe 10 years ago, where there was only 10%. Also, there's about there's innumerable health apps out there. The latest I saw was about 300 health apps out there that are really sort of dedicated toward m-health or mobile technology and health. And so I think that this is a rapidly growing field. I think that certainly COVID-19 has really sort of hastened the pace with which there's a huge adoption of mobile technology. Certainly patients can attest to the fact that they've seen an uptick in their televisits. There's been an uptick in sort of mobile outreach as well. I think we're just at the sort of the precipice, though. I think we're just at the beginning of mobile technology and what it can do. I think, big companies like Apple and Amazon are sort of moving into this field very rapidly because they realize that mobile technology can provide better health for patients. And you may ask, well, why can an app provide better health for me? I would tell you a couple of reasons. Mobile health can educate you about your condition. Mobile health can really sort of track any changes in your condition that you may not realize. Mobile technology, mobile apps can sort of enhance communication between care provider teams. And again, with the biometrics and things like that are coming out, mobile health can really sort of identify problems that you may not think are problems even before you think that they're a problem. Certainly on the transplant side, we're excited about mobile health. I developed many years ago Transplant Hero, which was acquired by CareDx, and then there's another app as well called Alicare out there. And these apps are really sort of dedicated toward really sort of promoting medication adherence toward or for patients. Again, really sort of adding on a layer of support for the patient. Again, the Transplant Hero, I'm so proud of this app and what we created over the years, because we really sort of created a mobile application that I really feel is really tailored for the patient in a really sort of simple and easy user interface to really sort of understand. And the reason why I'm most proud of it too is like we had a lot of feedback throughout the years from patients and really sort of tried to really sort of adopt some of their suggestions. It was really sort of, again, in terms of partnership, this is a true sort of like partnership with engagement with the patients through emails and things like that, where they sort of communicated things that they liked and things that they didn't like. And so we really sort of created a mobile app that I really sort of think fits a patient that wants a more simplified mobile experience. Certainly, though, there is the Alicare app as well, which is a very brilliantly made app by the CareDx team as well. This app has a little bit more bells and whistles for that. Like I drive like a Nissan Leaf, but people drive Ferraris. Like, A to B for me, if you want to get there a little faster,
right?
You go to the Ferrari or the Tesla, whatever you want. So I think that the Alicare app is that and more. gives you a lot of biometrics as well, which may be increasingly important for you as a patient. I think what's coming down the pike certainly is going to be this RPM, or that's what we say in the field, but remote patient monitoring devices. You already know about them: the thermometers, the pulse oximeters, scales, blood pressure cuffs. I think what I really think is that insurance companies are going to really start to mandate the utilization of mobile technology and these RPM devices, because I think ultimately what you're going to show in a large series is that you can decrease readmissions and ultimately decrease costs to the healthcare system, and really sort of unburden some of the system to really sort of take care of the sickest patients in-house, basically, and maybe sort of assess patients that maybe aren't quite as sick in a remote way.
Mm-hmm. Okay. Now, with this technology, how important is it with the connection to the care team? Does this technology get you straight to the people you need to talk to if you need to talk to them?
Yes, it does. On the Transplant Hero side, if you wanted to download that app, I think you have the Chiron here. Essentially, there is a Transplant Hero clinician sub app within the app that gives a sort of behavioral diagnostic to your care team about how adherent you are. And so if you appear to be non-adherent on the app, your care team will give you a call right away. On the Alicare side, we are feverishly working to make a provider-facing opportunity for essentially to build the bridge for the patient and the clinician, such that there can be a two-way sort of street in which perhaps medications are changed on the clinician side and are reflected on the patient side, and vice versa, essentially. And then also, but your original question, there is a messaging feature in the Alicare app that really sort of does allow you to really sort of get to the people that you need in a timely fashion. There's also in the Alicare app, there is a community. There's a lot of different communities out there, you know, and I've seen some come, some go along the way in the last 10 years. But I think that this platform and this community on the Alicare app I think it's here to stay. I think there's a lot of engagement out there that I've seen on the patient side.
Now, how important is having a support system on a broader scale when you're dealing with these digital technology?
So it's a great question. I think it's an adjunct to your social network. Certainly on the Transplant Hero side, there's another feature called Transplant Hero Guardian that allows your family and friends to follow along. Wow. Again, yeah. No person is an island. My mother taught me that when I was very young. And so what she say, honey gathers more flies than vinegar, or something like that. So I think you really sort of want to realize, I think what patients have realized, I think what centers have realized is that the more engagement we have around the patient, the better, essentially, the better care they will get. How we're trying to sort of maximize that engagement on the mobile app side is, again, through the Transplant Hero Guardian. I think this will only get better with time, is really sort of allowing patients' family members to really see how they're doing, and really sort of not just week to week, but really sort of on a day-to-day basis, how compliant they are with medications and things like that.
Oh, that's awesome. So if you had someone that was married that was a recipient, both spouse and the recipient can kind of share in that activity together.
That's exactly right. I'll do you one better. We need the Transplant Hero Guardian function because, again, someone wrote to me, a father wrote to me and said that his young son, he was 8 years old at the time, and had a liver transplant. And the father expressed a lot of anxiety and nervousness about letting his 8-year-old son go on a slumber party across the street, basically. And so that's basically the reason why we made the Transplant Hero Guardian function, is really sort of realize that patients aren't alone. They really sort of have someone on the back end helping them. And so certainly making the Transplant Hero Guardian function really sort of alleviated a lot of the stress for that parent. But as you allude to, spouses as well, it can alleviate a lot of stress as well for your significant other, as long as they know that they're checking in with you and that they can see that you've taken your medication.
And even, like you said, taking another step further for maybe teenagers in the adolescent years who may get a transplant and they may not be very adherent to their medication. They may go out or whatever, and their parent can have that guardian looking over their back to make sure they're keeping up with their regimen.
That's exactly right. I mean, it's sad to say, but that sort of, and we were all adolescents, so like I'm not judging anyone.
Sure.
I made some bad decisions when I was in that age group.
Yeah.
And so I think that you make some decisions that you probably look back on and realize weren't that smart when you're an adolescent. And so I think, to your point, this is the most non-adherent group of any age cohort when you look across the board. And so I think that Transplant Hero Guardian and features like that can really sort of go a long way in sort of providing another layer of support for the patient.
Absolutely. Okay, let's move on to tools to use throughout the transplant journey. And this comes back to the digital technology. Let's talk about simultaneously, since the Hero kind of works in conjunction or kind of side by side with Alicare. Can you name some of the key features of the app and the benefits?
Yeah, absolutely. So they do work side by side. I think the brilliance of CareDx is that they realize that not one app fits all for all patients. And so if you want a simpler app, a mobile experience, a simpler mobile experience, certainly download the Transplant Hero app, totally free. If you want something that has biometrics attached to it and a little bit more functionality, certainly the Alicare is there for you. You can download both of them like I have on my phone as well. Some of the key features, I think the way we designed Transplant Hero, the user interface is just very simple, very clean, and really sort of gets to the point. You can, again, it has the Transplant Hero Guardian feature, the Transplant Hero Clinician feature, and then it has you can email, you can share your medications with people, and then it also has a gamification piece on there as well. I thought that the gamification piece was only for children. You essentially, on the Transplant Hero app, you win virtual awards. But I would have people email me all the time that were adults saying, "We need more awards. We have been so adherent. We have gotten all the awards. We need more." Wow. And so I think that's a key feature on there as well that really sort of goes a long way to sort of promoting adherence. Sometimes you have a hard day. A little happy virtual award can go a long way.
Oh, absolutely. Absolutely.
On the Alicare side, Alicare is really sort of a beefy app. It really sort of gives you everything you need. It has some of the key features I like on there. It has the pictures of the pills. People have asked about that along the way. It really sort of has that. It allows you a little bit more customization in terms of scheduling the medication. That's very important as well. It has on there the ability to track urine output, water intake, which I think is important as well. I think the Alicare can be used on the pre-side as well because it allows you to track your urine output, your water intake. It does also interact with Bluetooth devices such as scales or RPM devices, so you can track your weight pre-transplant. I think I alluded to it before. It also has that community aspect in which patients can really sort of engage with other patients and ask them questions. I mean, obviously, if you get an answer, you should like vet it. Again, we're a family.
Oh, absolutely.
You have to vet it with your care team. If someone tells you to go swim with sharks, don't go swimming with sharks unless you talk to someone. But I think that I think that feature is awesome because I think, again, sometimes there can be a feeling of isolation once you have left the dialysis center, and I think the Alicare app really sort of realizes that and provides that social networking capability for patients.
Okay. Talk about, and here's one picture, the medication management using this app. We see right here in this example, they have 8 a.m. tacrolimus cap 1 milligram. So this app is pretty much a one-stop shop where you can load in your medication management, and it will remind you when it's time to take your medication.
That's exactly right. That's exactly what happens. The user interface or the API there is very robust. And so it gives patients the ability to really sort of customize. Now, I mean, you should customize it at the direction of your care provider, but it allows you to customize the dosages of your medication and the timing of your medication, and it gives you the picture of your medication. And then it has both apps have the alarm feature as well. Obviously, you set these medications at a specific time, and the apps will alarm for you and let you know when the medications are due. I think what I've always liked most about these apps is maybe pairing it with a mobile health wearable, not a mobile health wearable, but a wearable like Apple Watch. Or back in the day, they had Pebble watches and things like that. There's a lot of different. Google makes them now. A lot of different wearables out there that really sort of allow you to get an alert on your phone when a medication is due. Because the fact of it is after transplant, see if you're feeling great. You want to run a mile. You're feeling better than you've ever felt before. The food tastes better. Life is awesome. And so when life is great, sometimes you do forget to do things. Sometimes I forget to eat lunch. Or you're just a million things coming at you at once. And so having a wearable sometimes snaps you out of it and says, hey, in conjunction with the mobile app, and says, hey, your medications are due. Boom. I think it's a perfect situation.
Awesome. All right. 2 more questions, then we're done. But talking about tracking biometrics, you talked about a little bit about that, about monitoring the fluid, but also what other biometrics does this app tracks, and how important when you track it is it for the care team? I mean, you can have this information stored in the app and just take it with you to the appointment, and the care team can see all the information that you tracked over a period of time.
Yeah, so there's a lot of debate right now in the community about really sort of trying to figure out how much information the care team needs in terms of being able to make a decision. Certainly care teams don't want all of the information that's coming at them that if it's normal. So there has to be algorithms that need to be built in place to really sort of understand what normality is and really to sort of highlight when there's an abnormal result. So much so, I mean, if someone's, a center has 4,000 to 5,000 patients, they can't get alerted every time a blood pressure is being taken, essentially. And so I think these things are coming down the pike, smart algorithms to really sort of discern when numbers are abnormal or when readings are abnormal. In terms of the Alicare app, again, it pairs with a lot of RPM devices or remote patient monitoring devices. And so it inputs those devices into the app, and you can carry those with you. And there is a section on there where you can get a bar graph on the Alicare app, really sort of to give you a picture of how you've been doing over the last, whatever the time frame may be that you look at, maybe a month, maybe 6 months, to really sort of hone in on trends and things like that, which can be important. Ultimately, though, the care team will get that information, and that will be built into the system, because I think what hospital centers, large hospital centers are realizing, what insurance companies are realizing, is that they can't have this sort of sporadic data to make decisions. They want the sort of total picture to really sort of ensure that they're doing the best things that they can for you. And sort of the total picture is going to be that remote monitoring of you, and really highlighting any blips that may occur along the way, to really sort of hone in on those and see if perhaps you've missed 2 days of medication and they notice your blood pressure has gone up. Really to sort of hone in and really contact you and figure out what is going on. It may be something as simple as like maybe the pharmacy didn't really have that medication. And so instead of waiting, in the traditional sense, we would wait, maybe a week or 2 weeks to figure this out. Now, real time, we can go in and surgically strike and say, aha, here's the problem, we're going to fix it.
Wow, that's awesome. That's awesome. Last question. We know that the app also has some bonus features like transplant articles, events as well, to help with education and support. Can you talk about that portion of the app?
Yeah, absolutely. That's another fantastic portion of the Alicare app. It keeps, what I like about it as well is it gives you notifications of like of hot topics, like should I get the vaccine? You should get the vaccine. But hot topics that center on transplant, and so those are important as well. And then it gives you some of the latest news about transplant as well, and those sort of come up in a feed. And so it's not just sort of a mobile medication adherence app. It really sort of becomes almost like a lifeline for you, and it really sort of keeps you abreast of all the happenings in transplant. Really sort of keeps you informed, so much so that you can go into your care provider, your transplant center, and really sort of have an informed discussion about some of the newer things that are happening. Like I'll give you an example: the UNOS kidney allocation just changed 2 months ago, essentially. And that came up on the Alicare app. And if patients wanted to know, they would know that we've now gone to a 250 nautical mile allocation distribution system, whereas before we were sort of this, I was going to say gerrymandered, it's probably the wrong word, but gerrymandered sort of donor-specific area, like cookie cutter allocation system. Now we've gone to these concentric circles. So that can better inform you as a transplant patient on your options. Before, we would tell patients to list over here, and in New York specifically, we would tell patients to list in New Jersey, list here. These are two completely different donor-specific areas at the time. Now with the 250 nautical mile, I think you have more options, and you can really sort of pick and choose the transplant center and the people you feel most comfortable with.
Oh wow, that has that on the app?
Well, I mean, these kind of notifications come up basically and let you know.
Okay.
And so that I mean, obviously, as a transplant field, I'm acutely aware of the changes in allocation. As a patient, sometimes you may not be, but having that app, you would get sort of a news article or a hot topic that really sort of came up and sort of educate you about that.
All right, great. Before I end the show, I had a question from someone that has nothing to do with the technology. It's another question pertaining to transplant. And once you answer that question, I'm just going to ask you the importance of digital technology as we close. So we had a question from a gentleman that's on dialysis named Manny Philibots. And he asked, what are your thoughts on wrapping a donor kidney in silicone to reduce the amount of contact the organic tissues have together in order to lessen the immunosuppressant drugs?
So I would tell Manny that I spent a lot of time at Mass General doing a lot of research in terms of what drives rejection. And it's not really the contact with the actual kidney with the tissue. It's really sort of the blood that is flowing in and out of the organs, and specifically the white blood cells that are in the blood that go inside of the they don't just stay in the blood vessels. They flow into the kidney through the blood vessels, but then they sort of creep out of the blood vessels into the actual kidney parenchyma or the kidney tissue. And this is what really sort of is the problem. And you can wrap the kidney in a ham sandwich if you want. It's not going to sort of prevent the white blood cells from sort of coming into the kidney through the blood vessels and sort of we call it marginalization, moving out into the kidney parenchyma and sort of causing rejection. I hope that's not too flippant of a response, but it's really sort of the drivers are going to be those white blood cells and the donor white blood cells, and really sort of the interaction with those two. And that really happens really at the cellular level. Also, and the highway for that is not going to be direct contact. The highway for anything in the body is either going to be lymphatic channels or it's going to be blood supply. That's basically the channel, or obviously the gut. But mainly it's going to be those three. So in a kidney, there's no gut, and we've cut most of the lymphatic channels. So it's mainly the vehicle for the entry for the white blood cells that really sort of cause damage to the kidney are going to be through the bloodstream. That's it.
That makes a lot of sense.
Yeah.
Wow, that was awesome. Thank you for elaborating on that, Dr. Graham. So, Dr. Graham, from your experience as a transplant surgeon and a professor, just tell us an overview of how important digital technology is now, how important more today than yesterday years for patients dealing with kidney disease that's in the position of receiving a transplant or their post-transplant recipient. How important is digital technology in their care now?
Well, maybe I'll just use maybe a few metaphors. Maybe I never thought that I would ever drive an electric car. And I thought gas was here to stay. I'm sure the people that had horse and buggy never thought that they would see gas cars. I didn't think that there could be something such as a self-driving car, but that seems like that is rapidly approaching realization. I think mobile technology is really sort of on the rapid highway of realization in not just the transplant space, but in the total healthcare space. I think the reason for this is that healthcare companies, hospital centers, doctors, nurses, PAs, social workers, nutritionists are really beginning to realize that having mobile technology allows you access to the patient, allows you to communicate with them, allows you to really sort of have access to any changes that may occur on a day-to-day basis. And so, especially in the transplant side where things can happen so quickly, it really sort of allows you to put out any sort of smoldering fire before it becomes a conflagration. And so I think that it is here to stay. I think that the numbers don't lie in terms of how many smartphones there are. I think certainly one could argue that a lot of the adoption are in younger patients, but young patients get old too. And so I think what you're going to see is a shift, and I think it's going to be rapid. I think there's going to be a rapid shift toward mobile technology utilization as the younger population gets older, and as companies and really the government, probably through CMS, start to really sort of make it known that this is important for patient care. And then lastly, what I would say is I think, we all have these devices basically. I think that they serve a lot of great purposes, but I think the main purpose they really serve is communication. And so there's nothing more important in transplant than communication. And again, that partnership, every healthy partnership, whether it be a relationship or a marriage or a friendship or whatever really sort of starts with great communication. And I think that's what mobile technology allows for.
Absolutely. Wow. Yeah, I agree with you 100%, Dr. Graham, that this is the future. And I mean, let me ask, are these apps user-friendly?
Absolutely user-friendly, totally free, totally user-friendly. Again, there are 2 different apps that CareDx sponsors. Try them both out. See what you like, see what you don't like. And if you don't like something, CareDx has a 1-800 number, 24-hour assistance for both apps, and you can really sort of let them know what you like and what you don't like about the app. I think that Transplant sort of didn't come together because of one person. It came together because a bunch of people decided to work together to try to bring this to fruition. So I think mobile technology can really sort of grow to new leaps and bounds with more people sort of providing input into what they like and don't like about the digital space.
Oh, absolutely. Wow. Well, Dr. Graham, thank you for coming on, guys. Dr. Graham, he's Associate Professor of Surgery in the Monty Ford Einstein Center for Transplant at the Albert Einstein College. He's also the creator of the Transplant Hero. If you like to see what that technology is about, go to www.transplanthero.com, and you also can go to caredx.com to look at the Alicare App to see if these applications are right for you. Hey, Dr. Graham, I really appreciate you taking the time out. We went a little bit over the 45 minutes, but it was well worth it. And thank you, sir. And I look forward to many more transplant topic discussions.
Great. Thank you so much for having me, Steve. I think this was very important for patients. And I think your forum should be highlighted for the amount of information it gives to patients and really sort of the forum it provides. So thank you so much.
Oh, thank you. I appreciate that. I really do. Thank you so much, Doc.
Thank you.
I'll be talking to you soon. Take care. Bye. Have a good evening. All right. Guys, this was an awesome show. Share this broadcast. Play it over if you need to go back and hear some of the discussion we had on this show. But most importantly, check out these apps if you're a pre or transplant patient to see how they would benefit you in your care. So with that being said, thank you guys for watching. I really appreciate it. Check me out this Thursday, September the 2nd at 1 p.m. as we got an international show, DC to Kenya. Myself, Kidney Warrior and Kidney Ambassador Moses Kennedy, all the way from Kenya, and Maureen Gatti with the Renal Patient Society of Kenya. Thank you guys for watching. I appreciate you, and we will see you soon. Take care.
Brothers, my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta roll with ice. Cody's brothers, my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta roll with ice. Ride or die, 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 ride or die. Cody's brothers, my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta ride or die.